40. Thanks a lot for joining us again.
Thank you again. Okay, so you've worked hard to lose weight and get healthy, but what can you do to get the body that you've been working for while you've been working out? We're joined by Dr. Tad Grenga from the Chesapeake Center for Cosmetic and Plastic Surgery to talk about some of the plastic surgery and body contouring options after weight loss. Dr. Grenga, welcome back to the Hampton Road Show.
Good morning. It's good to be back.
So who would be a good candidate for this type of plastic surgery?
Well, firstly, it's important that a person's health be stable, and even if there are medical problems that come with that, maybe blood pressure, diabetes, those things should be stable. If medicated, the patient has to be taking their medications. Some instances will ask their medical doctor to clear them to have surgery and make that the safest thing that it can be for them when they want to pursue these sort of goals.
What can the plastic surgery do with all of that excess skin?
Well, that's pretty much the reason why we're mostly asked to help a person who's had the weight loss, whether they've had that on their own or if they've had that as a result of gastric bypass surgery, and that is to address what happens when all the weight is gone. And frequently the weight loss does not come with skin loss. There may be lots of extra skin left over. Mostly we'll see it on the abdomen, maybe the hips or the thighs, under the neck, the arms, and in some instances the breasts. And so plastic surgery offers those individuals who aren't yet confident about appearing in public with their new body shape and who possess lots and lots of extra skin left over to contour, to sculpt, and trim and nip and tuck those areas to refine and produce really the best shape that we can once an individual's reached their goal, their weight loss goals.
So if somebody's thinking about maybe considering this type of plastic surgery, I'm sure they want to know what is the recovery process like and the time period.
Yeah, very frequently I am asked what to expect with regard to recovery. Generally 4 to 6 weeks before resuming conditioning and exercises that are aerobic. On the other hand, most individuals can resume most of their activities of daily living to be up and around, walking about, resuming driving within 7 to 10 days of most of the procedures that we'll perform. We'll have some examples to show in a moment of those sort of things.
Which, yeah, we'll go to them. We have some photos here. You can explain, Dr. Grenga, what we're seeing and what you did.
Sure. This is an individual whose chief concern was the remaining skin on the arms, back of the arms, and often people call these their bat wings or their flappers. And it's very hard to conceal with short sleeves, especially as the weather gets warmer, want to wear short sleeves. So this involves a tuck of the extra skin on the back of the arms. You can see on the left where it hangs down, on the right where the skin now has been trimmed away. The scar is placed up underneath the arm, so it's mostly concealed there. And short sleeves can be worn now with a lot more confidence, self-confidence.
All right, the next photo, what do we have here?
This individual's skin relaxation occurred mostly in the neck. And so basically we'll utilize our traditional techniques that are facelifts and neck lift procedures to hike up and tuck all that extra skin out of there. There's usually very little fatty tissue remaining, so we'll allow an individual to resume a more youthful appearance really for the face and the neck as well, all at once with a neck lift to address that loose skin. Here's some loose skin on the thighs. It drapes down and in front, so it just is very hard to conceal even with with shorts and in the warmer weather. So when the skin is tucked away and the scar is hidden as much as possible in the natural folds or behind the visibility line there, we get a more youthful shape, not just a more youthful shape, but skin that's been snugged up. The same thing is true here in this example, which is a body lift patient, where we trim away skin of the tummy, tighten up the skin around the waist, all the way around the back actually. That makes the buttocks look firmer as well, give a more youthful, almost an athletic looking shape so that the loose skin is treated. So we have a person who's already lost the weight, they're at their ideal body weight and are maintaining that, and that's a key issue. We should maintain that for a period of time before one is deemed a candidate. Here's another example of a body lift where the loose skin and some of the extra fatty tissue remain on the torso, and by surgically tucking and nipping that, we'll see that we can do that mostly through hidden incisions and create a shape that can resume even a two-piece bathing suit if a person desires to do that. Okay. In our last example, this is where we're restoring the breast position, the perkiness, and some volume. We may need a breast implant to help make that happen, to create a more youthful and shapely breast after the weight loss, because sometimes that will take a devastating effect on the breast and the volume of the breast as well.
Well, thank you so much. Some great information. I know the pictures probably help folks out there to see the before and afters. Of course, for more information on post-weight loss surgical options, contact Dr. Grenga at the Chesapeake Center for Cosmetic and Plastic Surgery. Give them a call, 673-5900, or you can find him online at drgrenga.com. Thank you so much.
Thank you.
All right.